No country on earth spends as much on healthcare as the United States, but all that money leaves millions without care and millions more with care they can't rely on.
The American health system's flawed.
Of all the things that divide Americans, few are as deep or contentious as healthcare.
The nightmare of Obamacare.
It's very hard to wrap your head around how to navigate the whole system.
I've travelled America to look at what happens when the most advanced economy in the world can't guarantee healthcare for all.
We're actually here a little earlier than we usually get here. Like a whole 5 minutes.
I was diagnosed with breast cancer when I was 26, and that was in 2005. At the time, I had insurance through my employer. I was working for a real estate firm at the time. They did chemotherapy for 3 months, and then I had a bilateral mastectomy, and then I had to continue on one chemotherapy drug for another year.
Like every American, when Alison Abbott talks about healthcare, she talks about insurance. Because in America, the insurance plan you have determines the care you receive. And even with a good plan, there are bills to pay.
All of that costs, I want to say, upwards of $20,000 out of pocket for me. Probably more like 30 or more.
Imagine that, dealing with life-threatening illnesses and all the bills and bureaucracy.
Super scary. It's super overwhelming. Insurance just sends paperwork after paperwork after paperwork for every procedure that you're getting, and I was overwhelmed by all of it. I didn't know what to do with it. Luckily, my mom helped me organize a system, and I would take all of my bills that came in from the doctor's office, and I would take all of the explanation of benefits for my insurance, and I would match them all to make sure that I was paying the correct amount.
Give Mommy a big hug.
Let's go. I love you. How is it fair for people that aren't in my position, that aren't able to afford health insurance, to not be able to receive the same care that I can because I can't afford the insurance? It's not fair. So what's the answer? I don't know. I can't make sense of it all.
Alison recently found a small lump in her breast. She has good health cover now, but still has had to pay hundreds of dollars for tests, scans and biopsies, and hasn't yet had a diagnosis. When Barack Obama signed the Affordable Care Act into law, it was supposed to heal the problems. But what became known as Obamacare had its own flaws. His successor has unpicked some, but not all of it, despite his efforts.
I'm only signing because it costs nothing.
Politics has turned healthcare into a divisive issue, and the American people suffer.
So congratulations to everybody.
The number one rule when talking about healthcare in America is nothing is easy, as our president recently discovered. Nothing in healthcare is easy, nothing's black and white. There's no yes or no, it's all shades of gray. In situations where consumers aren't well informed, where there's monopoly power, where certain providers can charge whatever they want because there's nowhere else to go, those are what we call in economics market failures. And America has been weak to address the market failures in our healthcare system.
Healthcare in America is staggeringly complex. It's also a very fragmented system. Who pays who for what treatment and when is often not clear even to the person receiving that treatment. Even if you have healthcare insurance, you can lose it out of the blue, and many people rely on handouts for any healthcare at all.
This is the mobile medical program with Seattle-King County Public Health. Today our clinic is in Capitol Hill, a neighborhood just outside of downtown Seattle. We are parked in front of a community meal that serves a free lunch every day. And so we are here to reach out to people at a location where they're already accessing services so they don't need to make a special trip out to access a doctor, a nurse, and other services.
Do you have insurance? No, I have to pay everything out of my pocket. I'm 100%, so I got to pay for everything.
You know you're not going to be charged yet, right?
Okay.
For a variety of clients, this is where they access healthcare as their primary source. A number of clients will come onto the van and it's the first time they've seen a physician in 5, 10, or 15 years. And other clients are accessing medical care in more emergency care settings. Many of the clients that come onto this van are employed and they just are not currently sheltered.
If you're a person that comes down with a serious illness in this country and you go in and you have Medicare or whatever and you have private insurance, you're treated very well. And I think if you're poor and they don't really care as much, they just really don't care. If you pursue it, you can find it. But you're not going to have the best doctors are not going to come and say, I want to be your doctor. You know, they're not going to come knocking at your door. You got to kind of search around, I think, to try to find good care. There's a lot of people who are on Social Security or disability that get good medical care in this country. But mostly it's designed for the wealthy.
From this mobile clinic, you have to travel less than a mile to a place that illustrates the extremes in America. Seattle's Virginia Mason Hospital is regarded as a world leader in transforming healthcare. They advertise themselves as pioneers in trimming waste.
All across our nation, healthcare organizations and hospitals are constantly striving to offer exemplary care and perfect the patient experience.
This hospital is mentoring 5 NHS trusts in a program to improve efficiency by cutting errors. It's not just in hospital management where the best of American healthcare leads the world. This hospital in, where else but Silicon Valley, is using what America's tech incubator can offer to advance treatment.
Crossing hallway. Crossing hallway.
The robots that roam the corridors making deliveries are just half of it. The hundreds of robotic surgeries they do here benefit from the latest pioneering work of the tech brains just down the road.
The 3D is better than any 3D movie you'll ever see. And I've had many surgeons tell me it's like being inside the body.
The human movements of these robotic wrists are the latest step forward.
Industry and technology have actually advanced healthcare to the point that patients are having procedures done for quality of life that they wouldn't have approached before because they have other healthcare issues or families that they need to take care of or jobs that they need to go back to, right? So, but they're able to have surgery and almost return to work 2 or 3 days after they have their surgery.
Sorry, I have an ER.
What they call the improved outcomes for patients is why doctors here say this is an example of what America gets right.
Being an informed consumer is really important, and I think that's important in any healthcare system, right? But I think in the United States, you have options in regards to where you're getting your health care, which physicians you're going to, which subspecialists you're going to. So you have options in regards to what your outcome's going to be.
Those choices come at a price, though, one that's out of reach for many. It's an extraordinary statistic, but every year 700,000 people in America go bankrupt because of their medical bills.
So September 1st, 2011 was the date I was diagnosed with breast cancer. April 30th, 2012 was the date that my report came out, which for me signified the end of treatment.
Sonia will have the reminders for life. She also still has the bills and considered bankruptcy.
There were times that I didn't make my medical monthly payments, and if you don't make your monthly payments, then they can bill you for the whole thing, and you can't get on a payment plan again, and it's just this never-ending cycle.
She earns money now working in a hospital call center.
I'll get phone calls because I work overnight, and people will be like, I have this and this insurance. Will the emergency room help me? So people are wanting to go to the emergency room, but they're having to think through, will they take my insurance and will I be covered so that I can go get this help that I need? And just that just kind of is astounding to me that people have to have the conversation with themselves, like, I need help, but I need to go somewhere that will accept my insurance.
Most Americans pay for their health insurance through their employer. Millions more, military veterans and the elderly, already receive NHS-style government health care. Yet the model of a single-payer system for everyone is often demonized as socialized medicine.
We have the worst healthcare system in the developed world. Most people believe that we need a universal healthcare system because they're suffering.
Campaigners want to put a universal system for Washington state to the vote in November. It would be the country's first.
It has to happen. Every other developed country has figured this out. I don't know why our representatives in Congress or our legislature can't seem to figure it out. But we're going to apply as much pressure as possible, even if our ballot measure fails to get the amount of signatures we need or we don't pass, we're going to apply pressure so that they do pass this eventually. Thank you so much for signing today.
I believe that we all need universal health care, and it's a basic human right, part of living and being able to survive in this world.
There's so many things about healthcare that are absolutely tragic. So for me to say I'm not in favor of the approach that you're taking doesn't mean that I don't deeply, deeply care for people.
But they expect resistance from an industry that makes $65 billion a year.
Insurers discriminate because that's what the profit maximizing thing to do is. They're not bad people, the insurers. They're not evil. They're just saying, look, if I insure a sick guy, I'm going to lose money. If I insure a healthy guy, I'm going to make money. So I'm going to avoid the sick guys and sign up the healthy guys. Likewise, the providers in the medical system, you know, if you're a great hospital and you're the best hospital in the area and people are willing to pay whatever to come to you, you're in your right mind to charge whatever you want for those services. So it's not a matter of ethics or morality. It's a matter of the market. It's what the market will bear. And it's a market that by itself doesn't function properly.
It is a system of winners and losers, and a story best told by those who've survived it. Jonathan was diagnosed with testicular cancer at 28.
There's a strong correlation between body and mind, and here you are just trying to survive. You're trying to get through these very big surgeries. I had tubes going down my nose, a catheter, I couldn't move.
Now 6 years cancer-free, he knows he's lucky, but is scarred by the experience.
In many ways, America is a global leader, but we don't even take care of our own people. Let's say you have a rare form of cancer, and there's a doctor that is the expert in it, and they could keep you alive, but they're not in your health network. Now all of a sudden you're making a decision, well, can I afford groceries for my children? Could I pay my mortgage, or should I see this doctor? I heard a story the other day about a gentleman who couldn't afford to see the doctor. And eventually when he did, it was too late. A lot of these cancers spread so quickly, and you need to be seen as immediately as possible. And to know that this person's passing could have been avoided is a tragedy. And I just don't know how we change that.
And that is the reality of healthcare in America, where some get world-class treatment for their illness, but that same illness kills 50 people a day because they get no treatment. Those who rely on the NHS might reflect on its 70th anniversary, how lucky they are not to suffer the worst of a system like America's, but how they perhaps miss out on some of the best of a system that is far from caring for everyone.